So this is a deeper look in rural and urban health, a comparison of health status, community needs, and health promotion strategies between Richland County, South Carolina, and Saluda County, South Carolina. This is by Rama, Kelsey, Maureen, and Daniela. First, we have about Saluda County, South Carolina. It's about 43 miles from Columbia, the capital of the South Carolina, located near Lake Murray and the Saluda River. Has multiple restaurants throughout the community, one food line that's the main grocery store, multiple Hispanic markets, and multiple Dollar Generals. There are two gyms. The Saluda Recreation District is the only park in the county. There are zero nearby hospitals, but four family health clinics. For some statistics, there are 19,452 residents, according to the U.S. Census Bureau, living in Saluda County. 8,353 are employed. The average income for this community is about $52,000 a year, compared to the U.S. average income of about $78,000 a year. 84% of these residents have a high school diploma, and about 19% have a bachelor's degree or higher. There's also a 19% poverty rate in this community, and also 7% of these residents are foreign born. As part of the Saluda Health status, uh, heart disease, cancer, and stroke are the top causes of death in this community. Diabetes, suicide, motor crashes, and Alzheimer's are other prevalent causes. The smoking rate in this community is about 20.7%. 29.8% of adults do not participate in physical activity. 21% of adults are considered in poor health, and 40.8% of adults have a BMI of greater than 30.
I want to briefly highlight the key community health needs in Saluda County. Based on our ongoing community health needs assessment, these insights are helping us to understand where we can best focus our efforts for a healthier future. First, we know access to healthcare is a major concern, especially for people in rural areas with limited transportation and fewer providers. Mental health is also an urgent need with not enough services available and ongoing stigma that prevents people from getting the support they need. You can also see the substance abuse and tobacco use continue to affect many families, and we've also seen high rates of obesity and poor nutrition linked to limited access to healthy food and safety places to exercise. Other key issues include maternal health with limited prenatal care options, and oral health where many face challenges getting affordable dental services. Finally, we can't overlook the impact of social factors like poverty, unemployment, and low education levels. These all play a huge role in shaping long-term health outcomes. As we move forward, our goal is to work with community partners to address these challenges head on, improving services, access, and education for everyone in Saluda County. Thank you.
Moving on, Richland County, located in central South Carolina, is a largely urban county and home to Columbia, the state's capital. Richland is an important area in the state, not only politically, but also in terms of population, employment, and education. As of 2023, it has about 419,000 residents, with around 197,000 employed. The average annual income is $61,699. When it comes to education, about 92% of the population holds a high school diploma, and over 41% have earned a bachelor's degree or higher. The county also hosts major higher education institutions, including the University of South Carolina, which contributes to the region's economy and culture. Looking at the overall health of the population, about 91.2% of residents have some form of health coverage. However, there are some notable challenges. The obesity rate was 33.9% in 2022. Binge drinking affected 17% of the population, and 14.9% were smokers. When it comes to mortality, the leading causes are heart disease, cancer, and accidents. Meanwhile, for morbidity, the top issues include diabetes, chronic diseases, and mental health concerns. Despite decent infrastructure, lifestyle-related health issues are common in Richland County. 26% of the population is physically inactive, even though 76% have access to exercise opportunities. Barriers to physical activity include personal choice, lack of sidewalks, safety concerns, and few community events that encourage activity. When it comes to eating habits, many residents struggle with maintaining a healthy diet. According to data from MUSC Health, 59% eat fast food regularly, 36% say healthy food is too expensive, and 24% report being too tired after work to cook. Other challenges include a lack of nutritional knowledge and not cooking at home. All of these factors contribute to the 33.9% obesity rate mentioned earlier. Finally, let's talk about the community issues in Richland County. Affordable housing is a major concern. 17.8% of residents face severe housing problems. The county also has the second highest homelessness rate in South Carolina, with 743 individuals experiencing homelessness. Childcare is another challenge. There are only about 18,342 licensed childcare spaces. Yet, there are more than 24,000 children under the age of 5 living in the county. These gaps in housing and childcare access contribute to the overall health and well-being challenges faced by many families in the area.
I'm starting off with health promotion in the Saluda County rural. Mobile clinics and outreach, DHEC, and local providers send mobile units to rural communities to offer screenings, vaccines, and basic care. Health education, community events, church partnerships, and schools are used to spread awareness about chronic disease, nutrition, and exercise. WIC and SNAP access programs target maternal and child health, nutrition, and food security, crucial for rural families with limited grocery options, and challenges transportation barriers, fewer providers, and lower income levels. Okay, so the next one is the urban side. So we have local clinics and pharmacies. Health materials and services are more available in areas near Saluda Town Center. Community health fairs, occasional DHEC-backed events promote mental health, physical wellness, and preventive care. School-based programs and challenges and opportunities. Urban schools may have better funding for health classes, screenings, and wellness activities. Low-income populations face greater challenges in accessing health care, highlighting the need for targeted interventions. And the last slide is disease prevention in comparison in the urban and rural areas in Saluda. Chronic illnesses, heart disease, diabetes and hypertension, infectious disease, seasonal flu, and COVID-19, and the cancer rates are higher.